Welcome to the Trip Lab, kitchen table conversations about integrative medicine and psychedelics. I'm your host and resident physician, Dr. Mariella Wood. Hey everyone, welcome back. I am very excited to share this episode with you all today. I interviewed Dr. Emily Willow, who is a psychiatrist who has actually built her whole psychiatric career around psychedelic medicine and research. I don't have any news or updates for you guys today, so let's just jump right in, and first I'll tell you a little bit about her. Emily Willow, MD, is a psychiatrist, researcher, and educator based in San Francisco, California. She is an ardent advocate for psychedelic medicine and has worked on multiple clinical trials investigating psychedelic-assisted psychotherapy, including both MDMA and psilocybin. Additionally, Dr. Willow has a private practice in San Francisco, California, and is an attending psychiatrist at the University of California, San Francisco. She holds multiple mentorship and teaching roles, including at the California Institute of Integral Studies, CIIS, in the Center for Psychedelic Therapies and Research, and the School of Consciousness and Transformation. I had such a great time talking with Dr. Willow and all the variety of topics we discuss and what she was able to shed light on. To give you a little preview, we chat about the different molecules that she has experience with, including MDMA, ketamine, and psilocybin, and she's able to tell us about the difference between each of them and how each molecule may be better or in some cases not recommended, depending on each patient's personal history. We also dive into archetypal experiences that psychedelics, along with dream states and meditation, can induce within each of us that then lead us to understand ourselves and our place in the world to heal and grow. Dr. Willow and I both actually utilize tarot cards, too, to help with these consciousness exploring journeys, so we chat about that as well. I loved hearing her talk about the process she uses with her patients with tarot, and I think that you guys will too. And since this is the first time we're talking about tarot on this podcast, I do have a little bonus for anyone interested in tarot, which essentially, the way I describe it, is a deck of cards beautifully painted to represent the human experience. So if you want to learn more about tarot, I have a little snippet at the end that will explain a little bit more. So with all that, let's just jump right into our conversation. To start, can you just tell us a little bit about you, how you got into the psychedelic space, your journey, and what you do now?
Yeah, absolutely. So I first got involved with the psychedelic space when I was in medical school in Charleston, South Carolina, at MUSC. By the fates, one of the first MDMA clinical trials was being conducted in the same town that my medical school was. It wasn't associated with MUSC. It was sponsored by MAPS, the Multidisciplinary Association for Psychedelic Studies, and led by Michael and Annie Mithofer. And I happened to meet them through the Charleston Jung Society and learned about the work that they were doing. And prior to that, I was not really interested in psychedelics or really knew anything about psychedelic therapy. It was such a new thing, in, research. Obviously it had been happening for decades prior to that, but it was really new to me. And kind of from there, I can go into more detail, but one thing that really struck me in learning about the approach of psychedelic assisted therapy is that it was so different than what I was learning in medical school.
Mm-hmm.
It was very kind of getting at the root cause of things and understanding things from a more healing perspective than what we see in the kind of the Western medical model, which is really kind of addressing symptoms and, treating symptoms with medication and not really outside of, some examples like surgery or, antibiotics. We don't really, heal things in the same way that we do when we're thinking about psychedelic healing in mental health and psychiatry. So that really was just worldview shifting for me.
Yeah.
and kind of led me on this path of continuing to, volunteer and work with MAPS over the years. I worked on a couple of different clinical trials. And then, throughout my residency was involved, with psychedelic harm reduction, and the psychedelic research that's been happening. And now, kind of post residency, post psychiatry training and everything, I have a private practice where I offer ketamine assisted psychotherapy, and also I do what we call psychedelic integration psychotherapy, where you're not doing the actual psychedelic therapy with folks, but kind of from a harm reduction perspective, we're acknowledging and understanding that people are going to be using psychedelics on their own, and that lots of things, content, insights, wisdom comes up during these kind of quote unquote recreational experiences. And by doing kind of supportive integration psychotherapy, you can help people get the most out of those experiences. So that's kind of what I'm focusing on now in my private practice.
That's so cool. I love that because I feel like a lot of places are offering psychedelic assisted ketamine therapy, but kind of push off any other use of psychedelics that people are already doing. So that's really cool. So at the time, MAPS was doing the MDMA therapy, and I guess that's still their big main focus. So what was that like when it was first starting and you were in medical school? So like weren't even out and practicing yet. Like what kind of things did you learn and
Yeah. Kind of early on, like when I was in medical school, I learned a lot about the kind of psychedelic harm reduction angle. It was, as you said, like really early on, and because of the stigma, I couldn't really talk about it. Even into my psychiatry residency, at UCSF in San Francisco, I had teachers and, other instructors in my psychiatry training, kind of dissuade me from talking about it, from being involved. There was a lot of skepticism about, the efficacy of psychedelics. And certainly in South Carolina, where it's a lot more conservative, I didn't really feel safe talking about it. So it didn't feel, as comfortable or safe to talk about my interest, because I think kind of at that time to talk about psychedelic therapy was also to kind of ally yourself as someone who was like a drug user, and the stigma there, and not wanting to kind of put myself in that position, even though that wasn't the case at the time.
Right. Yeah.
So kind of wanting to like avoid those labels. But so what I really learned kind of during that time, I did some of the MDMA therapist training. I watched some videos. That's, back then it was really the training was really informal. Now they have a very formal therapist training program that takes place over months. And back then I kind of it was really informal and casual learning directly from Michael and Annie on, a few occasions. And it was so striking. And I think this is what kind of led me to deciding that I wanted to do this, as a career path, was just seeing how people were the participants in these clinical trials were so changed. In the MDMA clinical trials, they do 3 MDMA sessions.
It's a lot.
And it's like, so it's so few number of sessions. 3 times you're taking a medicine, and that's having this impact where, someone who has severe PTSD and they're suicidal and they're, been hospitalized multiple times, and their, relationships with their families or their partners is disintegrating. And they go from that level of functioning to, starting a company or starting a new job, or it's like a total 180.
Yeah.
And it's just like so amazing to see. And like at that time, like when you're in medical school, and I'm sure you remember this, you're being kind of taught in this, you're just like absorbing everything, right? And so to see something that's like just totally different than, what you're learning in the textbooks and like from your teachers, it was just really compelling. And I was like, I have to do this. I have to have to do what to be a part of it.
Yeah, I know exactly what you mean. In med school, you're kind of taught a lecture, and at the time you see it as that is the end all be all. That's what all doctors do. But what I've learned recently is that's just so not the case. And all of these like quote unquote alternative healing therapies, not even for mental health, but all areas of health, they can do a lot of good for people.
Yeah. And there's something about, I think, meeting the patient where they are rather than being like in the Western medical model, we're so paternalistic and prescriptive that there's this idea that we know what's best for the patient. And a lot of times that's true, but it's not always the case. And I think it's really important, like when you're doing like treatment planning or, in psychedelic therapy, we're setting aside, we're kind of bringing this beginner's mind perspective, and we're setting aside like our assumptions about what's right, and we're letting kind of the patient open up to their own inner healer, to their own kind of process with it. And it's just a totally different paradigm than we have in the kind of Western medical model.
Yeah. Now we're seeing all the studies about psychedelic therapy and also any other integrative medicine aspect. And the studies are actually there. Like a lot of this stuff works. We just weren't taught it. And so a lot of doctors still to this day assume it doesn't work. It's so interesting.
Yeah.
Was it hard when you were in residency? So you started out in med school, had this experience, and then in residency, you kind of just went down the normal path as people do during residency. Was it hard knowing that there's these alternative therapies out there that you couldn't pursue as much as you'd like during residency?
Yeah, it really was. And I appreciate you kind of pointing that out, because like when you're in residency, as you know, it's like you've got your blinders on, you're just kind of in survival mode, like getting through the, 80, 100-hour work weeks and, just kind of surviving. One of the things that I think was really helpful for me was being in a greater community of people, like outside of my residency. So other people who were, involved in research or, volunteering with MAPS or, in the kind of psychedelic harm reduction space, having a community of people like that kind of was this parallel like nourishment that I got like while and I was really lucky because there, are kind of more of us in the Bay Area than, other places. Like if I'd stayed in residency in Charleston, it would have been a different, definitely a different experience. So it was really great having that kind of community support. I feel really, lucky to have had that. And I actually I did my senior talk in residency on how I had this like parallel training program that I kind of created for myself. So like I had, everything that I was doing in my, regular kind of clinical training. I did a research track within my residency. So I was able to do some, psychedelic research work as a part of my residency. But then I like sought out like additional training. Like I completed the MDMA therapist training like while I was in residency. And I did some somatic training, and I did, some other things that really kind of supported my ultimate goal, kind of filling in some of the gaps of my interests. So that kind of made it, and as as you get further along, you have more kind of elective space, or like your schedule is a lot different than it is like when you're an intern, for example.
Wow. How did people respond to that when you did that as your senior project?
Most people on my program know me, so they kind of knew that that's what I was doing, but it tracked based on, how they do me. But I guess, it was a lot of work. It was a lot of extra work. So a lot of, doing kind of training stuff or tons of reading. And I feel like what's kind of funny, I guess, is that, I know a lot more about psychedelics than I do about, different antidepressants. I mean, I know a lot about antidepressants, but like, I feel like I know a lot more about, the history of psychedelic therapy than I do about, nitty gritty of like psychoanalysis or things like that.
Mhm.
So
That's so cool. I actually had a similar experience. So I'm obviously in family medicine, not psychiatry, but I did my final year research project about psychedelics, looking at primary care providers' views on psychedelics.
yeah.
And I mean, similar to you, people kind of expected I was going to go this route, but it was really interesting seeing the feedback when I presented it. A lot of people where they literally took the mic and said they wanted to try psychedelics after this. So I
Yeah.
don't know if that's good or bad for the residency program, but it was cool to see people's eyes open up to this whole different world.
Yeah. Yeah. And reducing the stigma by like
Yeah.
sharing your experience. That's so
Mhm.
important.
Yeah, yeah, like this podcast. That's why I'm doing it. So you've worked with MDMA, you do ketamine now, and then you worked with psilocybin before as well, right?
Yeah. On a group study. Yeah.
Since you've kind of done a lot of work with all of them, what do you think about each of the different molecules? Do you have one that you think works better, or do you think they're really kind of tailored for specific disorders?
Mm-hmm. Yeah, that's such a great question. I think kind of more the latter. I think, certain medicines are better for, certain things. One thing that I've learned with ketamine, so it's great for depression. It's great for acute suicidality. It can be useful for anxiety, and it's not that great for trauma. Um,
Mhm.
so kind of knowing those things. So like with ketamine, it's a dissociative anesthetic. And
Mhm.
so for people, a lot of people who have trauma, they tend to dissociate as a way to, protect themselves from, that's like a defense mechanism. And that can be really disorienting if you're, having a ketamine experience and you're feeling your body dissociate. That can be kind of almost like re-traumatizing or like anxiety provoking. So you have to be really careful. Like it's not like a total, contraindication, for trauma, but it's just not as great. I think that once we have more tools available to us, MDMA is so much better, from a neurobiology perspective, for like, in a experiential perspective for PTSD and trauma because of the way that it decreases our fear response. It tones down the amygdala response, and allows us to access traumatic memories without getting really overwhelmed and flooded. And that's something that ketamine or, psilocybin or LSD does not do. So, it starts to kind of separate out, I think, and for people who have maybe more mood instability, so maybe like in the bipolar spectrum, or tend to have more kind of affect instability, or have more like in the personality disorder range, MDMA might not be a great option because there can be a little bit of a mood drop sometimes after.
Yeah.
We don't see that as much we see that in recreational use for sure. But we don't see it quite so much in the clinical trials, which I think really kind of speaks to how important the support is and the psychotherapy aspect, for having, not having that, sometimes they call it like the Tuesday or Wednesday blues, like after
Mhm.
ecstasy.
Yeah.
So we don't necessarily see that in the clinical trials, but we're giving people follow-up phone calls like every other day
Um,
after they take MDMA. So the therapists are following up with them, and so you're really getting this kind of, tight container and support.
mm.
Yeah, so that's kind of a
Interesting. So I
overview.
wonder, I wonder if it's the doses that people are doing in a recreational setting that's also influencing that. But it's interesting that in the clinical setting, you don't really see kind of the serotonin depletion, as people call it. That's
Mhm. Yeah, yeah, yeah. And like, maybe it's just that, having the extra support,
Mhm.
you're able to tolerate it better. You might have more tools. That's one thing that we can't really look at in like a clinical trial setup. Like we can't do the research design where we're, not giving people the supportive psychotherapy, so we can't really compare it.
Yeah.
But it'll be really interesting, like as, this is, once we get FDA approval and we can do more comparisons like out in the wild, like what we might see, coming from that.
Yeah, that's so interesting. And it makes me think of too the risk of serotonin syndrome, which is a theoretical risk. But in the literature so far, it looks like from what I found, you may know differently, that there's been pretty much no cases of serotonin syndrome when it's done in a clinical setting, which I also find interesting. So I'm
Mhm.
wondering too if I mean, people in a recreational setting might be getting drugs laced with other things or taking other drugs together.
Right, right. Or yeah, being on an SSRI and like not reporting it or but yeah, you're right. In the clinical trials, we don't really see serotonin syndrome. And we have a lot of like medical monitoring, really
Mhm.
safe environment. So I think that's one of the benefits of the medical model for psychedelic therapy. I don't necessarily think that's the only thing that we should have available, but I think that that's a benefit of having the regulation. It's
Yeah.
the safety aspect, because serotonin syndrome can be fatal.
hmm Yeah. Gonna actually ask your opinion on what do you think about these drugs being legal for, I guess you can't really delineate whether it's going to be personal therapy use or recreational. But yeah, what are your thoughts about, because a lot of people think that they should be legal, but only strictly for medical use. So I'd be curious what you think about it.
Yeah, I really think that we need both the medical model, so like FDA approval, so that we can, doctors, nurse practitioners, prescribers can prescribe these medications and give them in the safe container that some people need. I also think that that can keep other people from accessing
hmm
psychedelic medicine. So like people who don't have pathology, for example, who don't have like psychiatric pathology, they wouldn't, meet criteria to, they're not diagnosed with something, for example. It becomes a little more difficult to give someone MDMA in a clinical setting if you don't have PTSD,
Right.
for example. You could do it off label, but you have to like, with a lot of things in medicine, you have to think about kind of medical legally, like what's defensible in a
hmm
malpractice suit. How are you going to say like this is the standard of care,
Right.
for example. So there's that aspect that you have to be cognizant of. But I think having recreational legalization of psychedelics in combination with a really robust public health education, system and safe spaces for people to use psychedelics, I think that that's as important, because just like meditation and yoga, or vipassana retreats, or things that we're doing as kind of individuals, even going to psychotherapy if you don't have a diagnosis, right? So these things that we're doing, and Bob Jesse calls it the betterment of well people, and
hmm
I really think that that's important. And I think, that we should be able to, it kind of brings up the question of cognitive liberty. Like, do we have the ability, the freedom to explore our own consciousness with the use of, consciousness altering substances? And I believe that we should, because I think, the people that maybe if we only had recreational psychedelics, for example, and we didn't have medical psychedelics, I think there will be a lot of people who wouldn't be able to access that care, because they need that more, they need more support, or maybe they only feel comfortable in a medical setting. I know lots of people, I have people that have come to me in my private practice specifically because I'm also an attending at UCSF. And so they feel like comfortable about having that kind of institutional connection. Even though this is my private practice, they feel a lot of comfort and safety in, that sort of like medical container, or, they're coming to see me because I'm a doctor, not a therapist, right?
Yeah.
Um, so I think that there, and then kind of brings, there's the other piece, which I think is also important, is religious use of psychedelics. I think that that's something that, all three of these kind of arms, are being pursued in different ways. And I think that, to have a really fair, productive psychedelic renaissance, I think we need to have all of those things available to folks.
Yeah, I completely agree. And especially what you were talking about with cognitive liberty, and also going back to just how we diagnose psychiatric disorders, as you clearly know very well. But it's wild how you can have one less symptom in the DSM and you technically don't have depression. And so it just points to the idea that mental health in general is such a sliding scale of not just mental health, but just our mental state. And so I feel like we shouldn't be the gatekeeper to whether people can explore their subconscious, like you said. So I completely agree. And we have alcohol and other mind altering substances that are legal. And so there's other substances that are technically way less harmful to the body that I think should also be legal.
Absolutely. And that's a really good point to bring up. There's the study that David Nutt did where you compare the relative harm of different substances, and alcohol and tobacco are much more harmful than psilocybin, for example.
Yeah, I read that study. It's so interesting, the graph that they put, and psilocybin and LSD are down at the very bottom and with barely any harm to the body at all. And alcohol is the highest. It's wild.
Yeah.
One thing I did want to ask about, so I listened to the other podcast that you did, and you kind of started to talk about these archetypal experiences that people have on ketamine and other psychedelics as well. But I know you mentioned ketamine specifically brings up these very archetypal experiences. I was just wondering if you could talk a little bit more about that and how that helps us heal, if that makes sense.
Yeah. I think kind of at this point, I have a more experience in medicine sessions with folks with ketamine because it's legally available, and that's what at this point I've done a lot more ketamine work with people than I have in the clinical trials. So I've seen lots of different types of experiences, and I think the idea of archetypal content is also it's a very Jungian perspective. So like depth psychology, the idea that within our psyches, we have this kind of wide range of archetypal characters within our own psyche. And sometimes, and there's a method of psychotherapy called internal family systems that is it's kind of a similar archetypal perspective, but it gives people a language to talk about their experiences. So often with PTSD, for example, there'll be a protector, like some sort of protector, and so when we think about hypervigilance, that protector has like an overblown responsibility and it's always on. And so like you start to, and maybe you have like an internal mother, like an internal, caregiver. A lot of people have like an inner critic, and we have these little characters start to come up, and it just gives a way to discuss, to kind of have a conversation with a patient about their experience. When I think like as a society, as a culture, we're not really great about talking about our feelings. And we're definitely not great about talking about different parts of ourselves. And so it just kind of makes it a little bit easier. And I think in the psychedelic space, so often, more often than not, the insights that we're getting are symbolic. And that's kind of, it's not literal, it's not logical, it's not, a teacher standing in front of you telling you what you need to change. It's like so much more symbolic than that. And, having these like, being able to discuss like with an archetypal lens, makes it a little more palatable maybe, and makes it a little bit easier to step aside from the literal translation, because a lot of times with psychedelics, and you see this a lot in recreational use, especially, you might get this insight that like, I've got to quit my job, and it's like, is it really literally that you need to quit your job? Is there something else that you need to look at? Oftentimes it's not that you need to like quit your job and move across the country. And, it's more that like there's something uncomfortable that you need to sit with. And so kind of thinking about it from an archetypal perspective allows you to kind of work with the patient a little in a like slowed down, less kind of like action. We're thinking about like, okay, what's the next thing that we're doing? It's like, how do we slow down and really understand like what that feeling was or what that impulse, to what does it mean to move or to quit, and kind of exploring that.
Yeah, that is so fascinating to me. Just the fact that when you take a psychedelic or even in the dream states or anything like that your mind puts together this picture of archetypes that help you have to figure it out. It's not just going to present it to you clearly, which I think is so fascinating. It reminds me a little bit of tarot, which I know that you sometimes use tarot or oracle cards in your practice. I'll just kind of give a quick explanation of tarot. But for me, tarot is basically a deck of cards, and every card represents a different archetype of the human experience, particularly with the major arcana cards, which are kind of the big archetypes. Like you were saying, even there's the emperor or the empress, which is the mother figure. And then there's the minor arcana, which are kind of little day-to-day moments. And so I feel like that just ties so well with what you were just explaining. So I'm kind of curious how you incorporate that. Like, do you use it during therapy, or would you pull a card based on what archetype the patient is expressing, or how do you use
that? That's a really great question. I think, depending on the patient, I kind of lean into that more or less. Kind of the same thing for astrology. I have a background in archetypal astrology, so I kind of will bring that in, like transits and that sort of thing. The way that I think about it and the way that I approach it with patients is just like we were talking about archetypes. This is giving it's giving more language to talk about our feelings or our experiences. And even if we don't want to fully buy in, if a patient, for example, like, I don't want to be prescriptive or, impose my worldview or a worldview on a patient, but the idea that we're giving another way of being introspective or self-reflective, that even if you don't want to think that, like, if you draw a card that it's, telling you something, it's a question to yourself. What does that mean to you? Like, what does the moon card mean to you? Like, when you think of the moon, like, what does that feel like? What does that evoke? It's so much more participatory. And I think that like using that as a tool can be really useful, and I use archetype cards, or like animals. Kim Kranz has an animal spirit deck that I really like, that is really kind of neutral. It's not, that doesn't go in one particular direction. I think the animals are easy to kind of connect with for people. So I use those at the start of medicine sessions to kind of help transition from okay, I'm thinking about my day. I'm thinking about, what I was doing right before this, or even like my intention for my medicine session. And it helps transition from that kind of thinking into like, okay, now we're connecting with something different. We're connecting to this oracular space, or this kind of, archetypal space or symbolic space, and kind of lets like a different part of your brain kind of engage, which I think is really helpful and useful when you're going into, a psychedelic journey.
Yeah. Do you feel like, would you pull a specific card, or would you kind of shuffle and draw a card and see what the patient thinks about it?
Yeah, I shuffle and have the patients pick a card. And then that's, one of the things that I really love doing in that kind of starting a ketamine journey practice is asking the question, what is something within me, so within the patient, that is supportive on my journey today?
I love that.
And so then it's like, it's already something within you that's supporting you, So it's like kind of like you can't lose.
Yeah. That is so cool. I love that so much. And I love tarot and I love psychedelics, but I feel like they do really go hand in hand together, because like you said, they're more like symbolic experiences that help you explore your subconscious.
Yeah, so absolutely.
Cool. So I know that you teach a course at CIIS, the history of psychedelic medicine. And I was wondering if you could tell us a little bit more about that course and what you kind of focus on when you teach it.
Yeah, absolutely. So teaching this course at CIIS, the California Institute for Integral Studies, in the philosophy of cosmology and consciousness master's program, or it's a master's and a PhD program. Teaching that course is one of my joys. I really love teaching, and I really love teaching this material and to these graduate students. It's yeah, just one of my favorite things that I get to do, and I feel so lucky that I get to do that. But the course, because it's in a philosophy program, I kind of have, it's not just a history of psychedelics. So like what I do is we walk through the history of humans using consciousness changing medicines. So starting, thousands of years ago, in caves in Algeria, and like the bee man murals on the wall, and like the bee mushroom kind of the murals. So like all the way through into like visioning the future of psychedelics. So like I kind of use this timeline, and we have these different modules, and we have like, deep history. We have like, the history of like the 60s, like the 50s and 60s, the current psychedelic, renaissance and the clinical trials that are happening now and kind of into the future. And it's a discussion-based course. And the questions that we're kind of exploring are, what are these kind of like ethical, philosophical dilemmas and questions that come up when we talk about like cultural appropriation. We talk about in the 50s and 60s was, Timothy Leary's method of kind of spreading, psychedelics to anyone and everyone, or does kind of like a more elitist, like giving psychedelics to specific people and having like that trickle down into policy, like what approach is better? And we kind of, maybe one isn't better than the other, but kind of exploring, those different things. And so we kind of talk about different kind of ethical dilemmas. And one of the things that we were talking about kind of in our the kind of visioning the future and kind of the current moment is capitalism and psychedelics, and like patenting psychedelics. And like, what does that mean? And like, who gets to own psychedelics, right? And like, and we can learn a lot from the cannabis industry and like kind of what's happened there. It's a little different because of the medical regulation, and that will kind of, I don't think that like cannabis, we will still have medical psychedelics. I don't think we'll have just like fully recreational like we do with cannabis. But anyway, it's kind of those sorts of questions that, there aren't any right answers, I don't think, but I think they're really important questions to ask and to think about, as we're actively right now creating the future of psychedelic medicine, like in this moment, like in this podcast, as we're talking, like we're helping shape the way that we're thinking about these things. So I think it's important to ask ourselves those sorts of questions.
Do you believe that, or I guess not believe, but I'm sure it comes up in your course, the idea of the stoned ape theory, where psychedelics kind of helped our human minds develop through the ages and become higher conscious beings?
I think it's definitely possible. I think Terence McKenna was the one who kind of came up with that theory. And I think it's definitely possible. I think that it's hard to know, I don't think that we'll ever know for sure. But if you look at, and I learned a lot about this, like when I was, doing research for like putting this course together, things like democracy, like things that are very psychedelic are like things that came out of cultures that we're now learning used psychedelics.
Oh, wow.
So it's kind of I think that that's really interesting to kind of to think about. And there's a really awesome book, The Immortality Key.
That's what I thought you were thinking of. Yeah, I read that
Yeah.
one.
Yeah. So that's a really great book that kind of talks about some of that stuff. So
Yeah. Yeah, that is fascinating. I didn't even think about that side of things, like the political development and how
mhm.
people, the cultures that did more psychedelics had this more democratic society.
Mhm.
That's fascinating. That is interesting.
Yeah.
Before we go, is there anything else that you'd like to share? Anything else about psychedelics that's on your mind that you think we should think about, just like the philosophy questions and the ethics? Anything like that you want to leave us with to ponder
Yeah.
on?
That's a great question. I think the thing that I think is probably the most important, and I'm going on a limb by saying that I don't like to speak
Right.
in extremes, but I think that it is the most important part of this space, and like what I'm dedicating a lot of my energy towards is this kind of the public education piece.
Mhm.
And the more that we understand about how to safely use psychedelics, the more that we educate our friends, the more that we talk about our experiences openly, which is not always safe, and kind of use your best judgment in that regard. But the more that we share our own experiences with psychedelics, and I think that that's going to contribute to an overall safer culture, because legalization of psychedelics, whether medical or otherwise, is coming.
Mhm.
And if we don't understand the risks and how to use these things, to benefit ourselves and our friends and our communities, it can potentially be really dangerous. So the more that we can educate ourselves, the more that we can read. I love psychedelic.support. I love Double Blind Magazine. There's a great newsletter from the psychedelics group at Berkeley that's
Mhm.
led by Michael Pollan,
Mhm.
called the Microdose, I think.
Yeah.
Um,
I get that one.
yes, yeah. So the more that we can educate ourselves, I think the better off we're going to be.
That's a really good point, because it truly, I think, what is scares people now is the stigma that was created in the 60s and 70s, and a lot of
Yeah.
that stuff just isn't true. I mean, of
Mhm.
course, psychedelics aren't completely harmless. They, can do a lot in your mind, of course. But
Right.
yeah, I agree. And thank you so much for coming on. I really
Yeah.
appreciate this conversation. I learned a lot, so thank you.
Yeah. Thank you for having me. This was a really fun experience, and I appreciate you inviting me.
Wow. Okay. So, thank you all for listening to all of that. As I mentioned in the beginning, I really had so much fun recording this episode. It definitely filled my cup by the end of this conversation, because the two of us share the same passion for demystifying psychedelics and educating the public about what psychedelics really do and don't do that people think do. So I will go ahead and link to Dr. Willow's website and all of her social media channels if you want to learn more about her and her work or connect with her. But now, as promised, I wanted to give you all a little taste of tarot. After this little spiel, I am definitely planning on doing a full episode on the tarot, because I truly believe it is an integrative medicine mental health technique that I have personally seen change people's lives in such a positive and impactful way. So today, I'm going to give you a little sample with a single card. So this is episode number 13 of my podcast, and today specifically is the first day of Scorpio season, for those of you that know anything about astrology. So I figured, what better card to start with than card number 13, the card that is associated with Scorpio, and the card that typically is the one that scares people away from the tarot due to its misconceptions portrayed in the movies. But in my opinion, one of the most positive and healing cards in the deck. So I'm going to tell you a little bit about the Death card. So when the Death card comes up, when you pull it for your single card pull, or it comes up in one of your tarot spreads, it does not mean you're going to die. It does not mean someone around you is going to die. It's really not about the physical body dying at all. It's not even the last card in the major arcana. It's actually right in the middle of the journey. So the major arcana is the part of the tarot deck that starts with the Fool and goes along the Fool's journey and ends with the World, and Death is actually right in the middle. The Death card is a beautiful and transformative card that truly paves the way for rebirth and growth, which is why it's in the middle. Just like the importance of the mycelium populating the ground and clearing away decay to create new life, the Death card is an archetype of representing finally an end to a vicious cycle, which is often happening in your mind or in your life, not physically you as a human being. It can indicate a toxic trait or an experience that you finally put to rest. You let that experience die in order to level up and expand your consciousness. Without death, there is no life. And even in French, and I do not speak French, so excuse me for my terrible French accent, but les petites morts, which literally means a little death, is a term used for an orgasm, named because you transcend the body through this experience. And there is so much more that we could talk about the Death card. It's definitely one of my favorite cards whenever it comes up in a reading. But with that, I will leave you a little preview of what our next episode is going to be about. So thank you all. I appreciate you listening. If you liked this episode, please subscribe and share so we can get the conversation started about integrative and psychedelic medicine. Let's destigmatize it and have open-minded conversations so we can fully explore what this could mean in the world.